Welcome back to your Pediatric Dentist channel Tiny Tip Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. Today we will discuss the growth assessment parameters, not so common but clinically important and sometimes may ask in theory exams for both undergrads and masters. Growth assessment parameters are various measures used to evaluate a child's physical development. They include indicators such as a chronological age, height, weight, sexual maturation, facial development, skeletal maturity, and dental progression. These parameters help in diagnosing growth related issues, planning treatments, and monitoring overall development. Growth assessment parameter provide a framework for understanding and managing a child's dental and skeletal development, ensuring timely, effective, and personalized dental care. There are various parameters. First is somatotypic age. Somatotype means body type. Dr. William Sheldon identified three primary somatotypes through 17 anthropometric measurements. Anthropometric measurements refer to the systematic collection and study of human body dimensions such as a height, weight, and limb circumference, which are not related to nutrition status. So first is endomorph, which is characterized by a stocky build, means a body build that is broad, solid, and sturdy, often with a lot of muscle and slightly shorter height, with the abundant subcutaneous fat, means a lot of fat present beneath the skin, and highly developed digestive viscera. Mesomorph, defined by a sturdy, means a strong, solid, and well built athletic build with the predominant muscle, bone, and connective tissue. Ectomorph is tall, thin, fragile, with the minimal subcutaneous fat and the muscle tissue. The maturation difference: in ectomorph they matures very late, and endomorph they matures very early. So somatotype provides a general idea of the child's developmental pattern, but it does not accurately predict their overall growth. Then second is chronologic age. It is the actual age of a child calculated from the date of birth. It is the simplest development parameter to determine, as it just involves knowing the child's birth date. The key points of chronological age are: first, easily determined. Chronologic age is straightforward to calculate and universally understood. Differences in development: children of the same chronological age can develop differently due to the various factors. First is maturation rates. Some children mature faster or slower than their peers. Diseases, chronic illness, or health conditions can impact a child's development. Environmental factor: nutrition, socio-economic status, and living conditions can affect growth and development. Although it is easy to determine, chronologic age is not an accurate indicator of development, nor it is a good predictor of growth. Not accurate indicator because chronologic age doesn't reflect individual growth variations or developmental progress. For example, two 10-year-old children may have a different heights, weights, and cognitive abilities due to the factors mentioned. Poor predictor of growth because it doesn't account for the timing and pace of growth spurts, which vary widely among children. It also fails to capture the complexity of the physical, cognitive, and emotional development. The third is height and weight age. Height and weight age are used to determine developmental age by comparing a child's physical measurement to standard growth curves for their chronologic age. Height and weight age are used to see how a child's growth compares to other kids the same age. We look at their height and weight and compare this measurement to standard growth charts, and these help us understand if the child is growing as expected for their actual age. So this is chart which is measure a child's weight and compare it to a standard growth chart for weight. By comparing the child's weight to this standard, can check if the child is at healthy weight for their age. In height age, first determination. Height age is assessed by comparing a child's height to a standardized growth charts, and this chart shows the typical growth patterns for children of the same chronologic age. Second is growth curves. Up to puberty, children's growth patterns generally follow similar curves. However, during and after puberty, individual differences in growth spurts significantly alter these curves. Third is factor influencing height. Genetics and environmental factors both play crucial roles in a child's height. Therefore, height alone isn't definitive predictor of a developmental age. And fourth, longitudinal measurement. Tracking a child's height over the time offers a more valuable insight into their individual growth pattern compared to a single measurement. In weight age, first is correlation with the height. Weight age is often correlated with the height age. However, it alone is a poor indicator of a growth or developmental age due to the numerous influencing factors like nutrition, health conditions, and lifestyle. Variability: weight can vary widely. Children of the same height and age, making it less reliable for assessing developmental progress. Clinical implications: growth spurts. Early growth spurts tend to be shorter while late matures often grow taller. This accounts for the height differences observed between male and female. And treatment planning: understanding these growth patterns is crucial for planning treatments in the pediatric dentistry and orthodontics. Recognizing when a child is likely to experience growth spurts help in timing interventions effectively. So height and weight age are valuable tools for assessing growth but must be considered alongside other factors for accurate developmental evaluation. Longitudinal tracking of the growth patterns provide the most useful information for treatment planning and monitoring progress. The fourth is sexual age. Sexual age refers to the development stages a child undergo during the puberty, driven by hormonal changes. These changes are categorized into 5 stages as outlined by the Reynolds, Vines, and Tanners, commonly known as the Tanner stages. Stage 1, prepubertal stage, where no visible signs of puberty are present. Stage 2, initial signs of puberty, including the beginning of the breast development in girls, testicular enlargement in boys. Stage 3, continued development of secondary sexual characteristics such as pubic hair growth and further breast enlargement. Stage 4 is significant development of secondary sexual characteristics include increasing pubic hair and growth of the genitals. Stage 5, full maturation of secondary sexual characteristics with adult-like pubic hair distribution and fully developed genitals. Relation to pubertal growth spurts. Pubertal growth spurt, a rapid increase in height and growth that occurs during puberty. The timing and extent of this growth spurt can vary but are closely linked to the Tanner stages. Developmental age and sexual age. The Tanner stage help determine a child's sexual age, which is a crucial aspect of their overall developmental age. The relationship between sexual age and pubertal growth spurts help in predicted growth patterns and developmental milestones. Fifth is facial age. Facial age is an important parameter in assessing the developmental growth of a children, particularly those who require craniofacial interventions. The primary goal is to determine if a child is following their unique facial growth pattern and to predict future growth accurately. Methods for measuring facial age. First is anthropometric measurements. These involve taking precise measurement of the facial dimensions such as the distance between the certain facial landmarks like between the eyes and nose and mouth. It helps in tracking changes over time and comparing them to the standard growth charts. Facial growth velocity curve. This method tracks the rate at which the different parts of the face grow over time. By plotting these growth rates on a curve, it helps identifying growth spurts and periods of slower growth. Understanding the velocity of the facial growth aids in predicted future changes and timing of interventions. And cephalometric radiographs. These are specialized X-ray images that capture the entire head including the facial bones. They provide detailed information about the skeletal structure of the face, allowing for the precise measurement and assessment of the growth patterns. And this method is particularly useful in orthodontics and craniofacial surgery planning. The sixth is skeletal age. It is a crucial parameter for assessing a child's developmental age because it correlates more strongly with overall development than other growth indicators. By utilizing skeletal age, healthcare professionals can make more informed decision about a child's growth and development, leading to a better treatment outcome. The key points is primary center of ossification. So each bone start developing from a primary center of ossification, and this center gradually changes in shape, size, and contour until the bone is fully fused. Assessment methods. Any skeletal growth center can be used to assess skeletal age, but the hand and wrist are most commonly examined. These areas are used particularly for assessing pubertal maturations. What are the advantages? First, recognizable ossification stages. The stages of the bone ossification are easily recognizable, making it straightforward to assess. Regular developmental sequence. Bone developed in a regular, predictable sequence from birth to adult, and this consistency allows for accurate tracking of a child's growth progress. Pattern of ossification. The progression of bone ossification, especially at the epiphyseal center, which is the growth plates at the end of the long bone, follows the characteristic patterns, and these patterns can be identified and used to determine skeletal age accurately. Coming to the hand and wrist radiograph, which is more commonly used. So the hand wrist region is made up of numerous small bones, which shows a predictable and scheduled pattern of appearance, ossification, and union from birth to maturity. Thus, by comparing a patient's radiograph with the standard that represent different skeletal ages, we find out the skeletal maturation status of the individual. For For that, first we have to understand the anatomy of the hand wrist region. So this region is made up of four group of bones, namely forearm, carpals, metacarpals and phalanges. This is the forearm. These are carpal bones. These five known as metacarpals, and these three sections known as a phalanges. These proximal phalanges, middle phalanges and the distal phalanges. First, distal end of long bones of forearm. So the distal end of the long bones of the forearm refer to the farthest part of the radius and ulna bones. This is the radius and ulna bone, which are located near the wrist. These bones form part of the first group of bones that develop and ossify as a child grows, and these give rise to the distal projections of their representative sides called the radial and ulnar styloid. Means that the far end, which is the distal end of the radius and ulna bones in the forearm, extend into the projections or the pointed parts, and these specific projections are called the radial styloid on the radius and ulnar styloid on the ulna. They are important anatomical landmarks near the wrist and play a role in the movement and stability of the wrist joint. Then carpals. These consist of the 8 small irregularly shaped bones arranged in the two rows. So first proximal row and the second is distal row. Proximal rows scaphoid, lunate, triquetral and pisiform. So you can that pisiform, triquetrum, lunate, scaphoid, and the distal row trapezoid, trapezium, capitate, and hamate. Coming to the metacarpals, 5 miniature long bones forming the skeletal framework of a palm of a hand. Each metacarpal ossifies from one primary and one secondary center. So these 5 are the metacarpals. 1, 2, 3, 4, and 5. Then phalanges. These are small bones forming the fingers, and these are 3 in number except for thumb, which has 2, and these 3 bones are called as proximal, middle and distal. So these are phalanges. 1, 2, 3. These are the proximal phalanges, these are middle phalanges, and these are distal phalanges. In thumb, there is a proximal phalanges and the distal phalanges. Sesamoid bone. Small nodular bone often represent embedded in the tendinous region of thumb. So this is the sesamoid bone. Indications of hand wrist radiograph in patients who exhibit major difference between chronologic and dental age. When a child's dental development does not match their chronologic age, hand wrist radiograph help determine the child's actual skeletal maturity. A determination of skeletal maturity prior to treatment of the skeletal malocclusion. For accurate treatment planning of the skeletal malocclusion, it's crucial to understand the patient's skeletal maturity. This ensures that orthodontic and surgical treatments are timed correctly to coincide with the growth spurts. To assess skeletal age in the patient whose growth is affected by the neoplastic infectious conditions. Conditions like tumor or infections can affect a child's growth. Hand wrist radiograph are used to assess how these conditions are impacting skeletal development. Help predict future skeletal maturation rate and status. By evaluating the current state of bone development, radiographs can help to predict the future rate and the status of the skeletal maturation. To predict pubertal growth spurt, the pubertal growth spurt is a critical period of rapid growth. Hand wrist radiograph can help predict when this spurt will occur, aiding in the timing of growth related treatment. Studying role of hereditary environmental nutrition on the skeletal maturational pattern. These radiographs provide insights how genetic factor, environmental influences, and nutritional status affect a child's skeletal maturation pattern. In patients with a skeletal malocclusion needing orthodontic surgery to assess growth status. For a patient with the skeletal malocclusion requiring orthodontic surgery, hand wrist radiograph help determine the best timing for surgery based on the patient's growth status. Coming to the determination of the skeletal age, the APA view radiograph of the left hand and wrist are considered to be standard for determining skeletal age. The following are conventionally followed method for skeletal age assessment. Shurulich and Pyle published an atlas of standard hand wrist radiograph for male and female at various ages. For determination of skeletal age, one compares the radiograph of left hand wrist region of the child with the atlas standard beginning with the same sex and nearest chronologic date. The hand wrist standard that superficially resemble the child's radiograph is chosen for more detailed comparison. All the bones bones are assessed and each center is given a skeletal age of the standard and overall age is then determined. Tanner and Whitehouse suggested three methods of scoring maturity of individual bone to determine skeletal age. First is radius ulna short bone score, Russ score, carpal bone method and TW2 method. Terringer et al. Gave mean appearance time of bone stages. Jork and Helm compared the stages of the bone development to growth velocity and correlate 7 maturational stage to the pubertal growth spurts. Grave and Brown further corroborate the evidence of the Jork and Helm and include more ossification centers. They divided skeletal development into 9 stages, each representing a level of skeletal maturity. Scoff in 1978 gave specific chronological age at each of these stages. So these are the 9 stages. So this image shows a series of stages depicting the development of bones in the hand and wrist, specifically focusing on the growth and ossification patterns during childhood and adolescence. Each stage is associated with a specific age range for male and female, indicating the typical age at which this developmental milestone occurs. This information is relevant for understanding the timing of the skeletal growth and development, which can be useful in the field such as the pediatric orthopedics and the forensic science. Stage 1 is the epiphysis and diaphysis of proximal phalanx of index finger are equal. So epiphysis means growth plate and the diaphysis is shaft. So growth plate and shaft both are in an equal stage of the proximal phalanx, which is the finger bone of the index finger, are equal in size. 3 years before peak velocity of the pubertal growth spurts means time before peak growth spurt is approximately 3 years. So the age is 10.6 years for male and female is 8.1 years. In second stage, epiphysis and diaphysis of the middle phalanx of the middle finger are equal. In stage 1, proximal phalanx of the index finger, and stage 2, middle phalanx of the middle finger. The age for male is 12 years and female is 8.1 years. Stage 3, characterized by the area of ossification. We can see the area of ossifications, this red color. Hemular process of the hamate, ossification of pisiform. The age for male are 12.6 years and females 9.6 years. In stage 4, marks the beginning of the pubertal growth spurts, increased mineralization of ulnar sesamoid in thumb, and increased ossification of hemular process of hamate. So stage 4 is the beginning of the pubertal growth spurt with the increased mineralization of the ulnar sesamoid in the thumb and further ossification of hemular process of the hamate bone. And the age for males 13 years and female 10.6 years. Stage 5, peak of pubertal growth spurt. Epiphysis caps diaphysis in the middle phalanx. So epiphysis caps the diaphysis. Here we can see the same epiphysis and the diaphysis of proximal phalanx are equal. Here also there is a equal, but the middle phalanx. In stage 3 we saw the ossification start. In stage 4 there is a mark ossification, there is a beginning of the pubertal growth and mineralization of the ulnar and the sesamoid bone. In stage 5 the epiphysis caps the diaphysis in the middle phalanx of the third finger and proximal phalanx of the thumb and the radius. For that stage, age of the male is 14 years and female 11 years. So it is a distal phalanx. Stage 6, end of the pubertal growth, union of epiphysis and diaphysis of the distal phalanx of the middle finger. So this is the distal phalanx and there is a union of the epiphysis and diaphysis. The age of male is 15 years and female 13 years. In stage 7, union of epiphysis and diaphysis of the proximal phalanx of the middle finger. So proximal phalanx of the middle finger. In stage 6, there is a union of the distal phalanx. Here the union of the proximal phalanx. For age of male is 15.9 years and female 13.3 years. In stage 8, fusion between epiphysis and diaphysis of the middle phalanx of the middle finger. And the age is male 16.9 years and female 13.9 years. And stage 9 signifies end of the skeletal growth. Fusion of epiphysis and diaphysis of radius. This is the radius bone. So there is a union of the epiphysis and the diaphysis, and the age for male 18.5 years and female 16 years. These are the references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday and Sunday. Also we try to put MCQs according to topics on our shorts with the answers and explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.